Hi, everyone, and welcome to another episode of Catching Up on the Couch. I'm your host, Christine Matelan, and today's topic is open enrollment for the year 2025. I am joined by nick.maurizi and damien.granda, which you may recognize him from before. So, gentlemen, I want to thank you both for taking time out of your busy schedules at Banker's Life to be here for us. And what we do here is we try to help our patients connect correctly with insurance. So we're going to give you a little overview and we're going to give you some suggestions. I've already had patients calling me that are already getting ready for their 6 month prior to turning 65 and having conversations with them about what is the best choices for them in the new year. And everyone thinks that when you say the year 2025, we're just talking about people that will turn 65 in 2025. But the key is 6 months before, you're going to start getting things in the mail. You might start getting phone calls. You want to get yourself prepared. Get yourself an appointment with a broker. Basically, they'll talk to you over the phone. I'm sure you guys FaceTime with clients, maybe meet them at Panera or
whatever's comfortable.
All the above, yep.
So this is a training for those of you that you might have just turned 64, but you have, time to think about things and get things in order. So we're going to start with Damien, and let's talk about Medicare ABC, the Medicare Alphabet.
Yes. Well, you nailed it on the head. Starting 6 months early gives you plenty of time to understand it. So whenever you turn 65, you can elect to get onto Medicare. So Part A is all your hospital coverage. So I always joke it's like a crummy hotel stay. It's just the 4 walls and a bed. Part B covers the doctor expenses, so everything that happens to you inside those 4 walls. I'm going to skip Part C real quick and go to Part D, being your prescription coverage. The only reason I skipped Part C is because it really replaces Part A, B, and D all under one umbrella.
Okay.
And that's the Medicare Advantage plan.
Okay. All right. So, Nick, tell us what a donut hole is.
The infamous donut hole.
Yeah.
Yes. So with Part D, the prescription drug coverage of Medicare, it has different phases of coverage. And as you move through them, you're exposed to various copays. So for folks already on Medicare this year, moving into 2025, this is where we're going to see the biggest changes. And for folks new to Medicare, it's good that they're aware of these changes to Part D. So this all stems out of the Inflation Reduction Act. They're actually doing away with the dreaded donut hole.
Okay.
So
should we clap?
Yeah, it is. This is clap worthy and for many beneficiaries of Medicare. So, previous when you hit the donut hole, your cost share normally went up. It increased. Now they're putting a $2,000 hard cap on your out-of-pocket drug costs. So once you hit that limit, you don't have any more exposure to out-of-pocket costs when it comes to your drugs. They're also introducing a payment plan for 2025. This will allow you to kind of smooth your out-of-pocket costs out over the calendar year. So basically what's happening behind the scenes is your insurance company will pay the pharmacy, and then you'll pay your insurance company in more even installments as opposed to getting whacked with large chunks of money out of pocket up front as you move through the year. So big changes. If there's ever a year to sit with a local professional and have your plan reviewed and how it's going to impact you, this is the year to do it.
Okay, now you say $2,000 cap.
Mm-hmm.
Is that $2,000 out of the patient pocket, or once they reach a medication that costs $2,000?
No, great question. So that's a total out-of-pocket of $2,000 that the patient would pay for all of their prescriptions.
Okay.
Yes, it's like a cumulative total.
Okay.
Yep, great question.
Good to know. Okay, Damien, let's talk about the enrollment period.
Yes. So the most important one is when you're turning 65. You have 6 months before your birthday where you're going to get phone calls, emails, literature in the mail telling you that you're the most popular person on the block, because you get a one-stop shop to really make the best decision for your healthcare to start. So 6 months, you can start gathering information and even roll into a Medicare supplement. And 3 months before your birthday, you can actually start looking at the drug plans and the Medicare Advantage plans. Now, through the course of your Medicare career, you're going to have a few other enrollment periods, such as one we're creeping up on, the annual election period, which is October 15th through December 7th.
Okay, those are very important dates to remember.
Yep, and just the same again, October 15th through December 7th. And that's where you get to make all the changes based on how the healthcare plans are changing year to year. So providers change, co-payments change, and so does prescription formularies. And then there's the open election period, which is actually January 1st to March 31st, for folks that have things that come up over the winter where they weren't able to look at their healthcare. They can have one more chance to get it right at the beginning of the year, and that's typically where they're locked in at for all of 2025. Now, sometimes there are special election periods for moving out of a service area, income-based enrollment periods if you're newly eligible for an income enrollment and things like that. A lot of those are very one-off, and that's what Nick and I help our clients with throughout the year. They call us with a question, and if they have opportunity to change or adjust, that's what we look into for them.
Okay. And it's really important that you sit with a broker or one of these gentlemen. I had a patient call. She's on 2 very expensive medications. And once she turns 65, she won't be eligible for any of those copay programs through the manufacturer anymore, those
Correct.
assistance type programs or reimbursements. And she was told, oh, honey, this plan is going to cover everything for you and you're not going to pay one dime. And when I told her you're on 2 medications, one injectable, one infusible, Medicare with a supplement is the way to go because your Medicare is going to pick up that 80 and the supplement pick up that 20. There you owe not a dime. But when she called and said, well, what about these 2 medications? They told her, we can't answer that right now because you're not a member yet. So be leery about what people try to tell you over the phone. Now is the time you're going to see all these commercials from famous athletes, famous TV stars telling you, you know, you might be able to get more money depending on your zip code, transportation to the doctor, Meals on Wheels, transportation to the hospital, free ambulance rides. So these guys know from A to Z everything that you need to know, and things do come up. So if you do choose the wrong plan, you have that option in January to say, mm-mm. And that's a free pass, correct?
Yep.
If you try to do it again later on, there's a penalty.
So not necessarily a penalty, but kind of handcuffs put on you. Typically throughout the year after that, there aren't eligibilities for changing, like I said, unless it's moving out of a service area and things like that. But you nailed it on the head. Nick and I, what we kind of pride ourselves in is sitting with clients and giving you the good, bad, and ugly. Because the best surprise is no surprise, the way I look at healthcare.
Right.
So we're typically very upfront, and we use Medicare.gov, so the government website, to show exactly what they predict co-payments and costs of prescriptions and things like that for.
Absolutely.
Okay, so Nick, let's turn back to you. Tell me about the different types of Medicare. We know red, white, and blue.
Right. So that's the original Medicare program. That's your Parts A and B that you get through Social Security. And then there are a few different ways you can supplement or augment that. The original way, the Medicare supplement plans, also known as Medigap plans, you'll hear that term thrown around, which is what you alluded to. That's the one that comes in, backs up your A and B, picks up the 20% that B leaves behind. For many folks, that's the right option. Just depends on how they doctor, their health issues.
And of course, you need a pharmacy plan with that.
Yes, for that one, you have
for oral medications or...
Exactly. You have a standalone Part D or prescription drug plan that we talked about earlier. But you made an excellent point. This is the time of year where everyone's trying to wow you with extra benefits, and you really have to be careful. You have to sit down, understand your options, because just because you get extra dental doesn't mean it's the best plan for you.
There is no good dental. Sorry, everybody, but there's not.
The other common option, the kind of newer way of supplementing Medicare, is the Medicare Advantage plans. So this is the Part C that you hear about. These plans hit the market really in the early 2000s. They have come a long way since then. And the way to think about Medicare Advantage plans is it's a private health insurance company, all the names you're used to hearing, the regional carriers, the national carriers. And they basically come in and take over your Medicare. So they come in and manage your A, your B, and in most cases your D, your prescription drugs, and they bundle it all into one. And that's what's known as Part C. These are also a lot of the plans that you reference that you see the commercials for on TV. They tend to come with extra ancillary benefits. But, both sides of the fence, whether you're looking at Medigap or Medicare Advantage, they have their pros and cons, and it really depends on your situation. And that's why you have to sit down with somebody. You have to understand all of the options available to you. And then there are some other plans out there, like people that work for the government, certain employers like union plans. So we have a lot of clients with federal employee health benefits, VA benefits, TRICARE. Sometimes, these things can mesh well with Medicare. Other times there's things you need to be aware of. We are familiar with how those things work alongside Medicare, and we make sure we always take that into consideration when we sit with somebody. So,
okay.
Yeah.
And then let's talk about, this is a big thing in our office, and we'll have a snippet on this lovely world of patients with so many cards. Your medication card, your healthcare card,
Yes.
your ARP card, your AAA card. We all have too many of those in our wallet, but the most important ones that we need would be.
Yes. So if you're on original Medicare with a Medigap, then you definitely want your red, white, and blue card. You want your Medigap card. And then when you go to the pharmacy, in that case, you'd want your prescription card. With Part C or Medicare Advantage, typically you just have to carry around your Medicare Advantage plan because, again, everything's bundled into one. So whether you're at the doctor's office or the pharmacy, their hospital, kind of one card to show them all.
And they may change every year. Those Part C cards, C Advantage plans, they can change by one number or one alpha character. And you may say to my front desk, nothing has changed. I have exactly the same thing. I get a new card every year.
Right.
My anniversary date is June. So my card comes in June. I compare it to last year's card, and then I cut last year's card up. I write the year, 2024, on my new card, and I still have to present it. So I'm just going to throw this in there really, really quickly. Don't get mad at my staff if they say I physically need to hold your card.
Right.
We can't process payment. We can't process prior authorizations without the card.
Yep.
So that gave me a little need those.
Make an excellent point too. With Medicare Advantage plans in general, they can change annually. The benefit structures, the premiums, as Damien alluded to, the formularies, the network of doctors, and with Medigap, those benefits stay the same. So it is something to be aware of. But like you said, get your new card, give it to all your
Laminate
healthcare,
it.
Yeah, all your healthcare providers,
Yes.
right?
Don't need to go through the wash.
No, but we really do need those.
Right.
And then we don't want you getting upset that we weren't able to get you a medication. We don't know what your pharmacy benefit is.
Yep.
Sometimes on the Advantage plans, it has all that information for us.
Right.
Yep.
Other times you get a different card.
Yep.
All right. Damien, let's talk about financial assistance for prescriptions.
Yes. There's too many levels to sum up today, but I know you guys do a great job of having assistance programs on your website, so check it out. But Nick and I also talk to a lot of folks on Medicare because income limits change and just availability of programs changes. Things like PACE or PACE-Net, which is income driven.
What are the limits? Are they still?
So they haven't published next year's that I've seen yet. So I don't want to give you an answer that I'm wrong.
Okay.
But for this year, it was $33,500 for a single individual for PACE-Net, and lower for PACE, I don't have that one memorized, and then $42,000 for a married couple.
But, you know, it's
It's
pretty
substantial.
reasonable.
When you start kicking on to fixed incomes, a lot of folks that may just receive Social Security benefits and things like that. So we have a bunch of clients that qualify for it. And the good news about it is it actually limits how much a prescription can cost. So if your Part D plan doesn't cover it well, it might be cheaper under PACE or PACE-Net. The other
And
couple,
you are allowed to have that with everything else that you have.
Absolutely.
If you
Yep.
qualify, take advantage of it. There's nothing to be ashamed of. It's through the state.
free program that's ran
I've
through the PA lottery.
I've seen copays of $2.
Yep, they cap them at 15. That's the worst case scenario under either of the programs, or less. So that's good news. The other things I've looked at are things like Lilly Cares.
Mm-hmm.
It's a great source, and it's for certain prescriptions, but they do have more generous income limits, depending on what tier and what level. Up to $80,000, and you can still get your prescriptions free or very, very cheap compared to retail cost.
And you can be enrolled in Medicare with Lilly Cares.
Yep.
All of the manufacturers have their own programs. They're all limited by income. So I think Lilly Cares and at one time Safety Net with Amgen was up over 90,000. I think that's changed a little bit. We'll get into that at another time, but take advantage of it. I encourage my family to look into it.
Even things like GoodRx, it's not the perfect solution, but for some prescriptions, it is cheaper. So some of the legwork Nick and I have done is looked at the projected prescription costs on Medicare.gov, and then went through each prescription that's kind of crazy in cost and pulled it up on GoodRx. Then we can tell our clients, they say, hey, these prescriptions go through your Part D, and here's the code that'll help you use GoodRx, just to cut costs as much as possible.
Do you know what the premium is, gentlemen, for 2025?
The
For Part
Part B,
Yes.
It's not published yet either, but they're estimating there's definitely.
Okay.
they're
Yeah.
anticipating probably $10-ish
Yeah. Around 180.
is kind of what we've been told through our trainings and stuff. But again, it hasn't been published yet, unfortunately. A lot of people are knocking our doors asking.
Okay.
Yes.
So they haven't published all the changes and all the income limit adjustments for next year yet. But it's something we check
And look
daily.
for that Social Security
Mm-hmm.
increase. It may not be that much, but it's something to take into account when shopping around. And as I said earlier, these gentlemen know everything from A to Z, including Medicare A through F. I think there's still G,
There's still G.
There's still G.
and they can get into that more with you. But we like to educate our patients. We want you to be healthy. We want you to get the medicines that you need. We understand when they prescribe something and you say, doctor, but the copay is $365. You know, I can't do that. There are ways to make that happen, always. And we try to help as much as we can. But unfortunately, those applications need to be filled out 90% by you, 10% by us. So we need you to do your share of the work in that too. Lastly, let's see. I'm going to give you these gentlemen's phone numbers. We're going to list their emails on the website because they have a tendency to be a little long. And so, Nick, let's start with you.
The best way to get a hold of me, my direct contact number is 412-552-8672.
Okay. And Damien?
412-282-6056.
Okay. And don't call and try to make an appointment with them for the office.
Yeah.
You need to make an appointment with them outside of the office,
Right.
unless you happen to be in the office and one of them happen to be, this is their busy season.
Yes.
So lastly, I'm going to show you what we have hanging up in the waiting room. So we don't have a fancy picture of Nick on here, but these are scattered throughout the office. They're hanging up in the usual places that you'd see them. There's a QR code. You can just scan it, and it'll take you right to
Our personal website.
your personal website, and I'm sure you have one too.
Yeah.
And then also, Mr. Damien can help those getting close to retirement or in retirement trying to figure out what to do, secure your retirement. So, and he's given his phone number on that too. These are also scattered throughout the office, along with both gentlemen's business cards. And don't be surprised if Dr. Stupai asks you, you know, I see you're coming up on 65. Have you decided what to do? And she whips out those cards because she cares about you too. So lastly, one more time, Nick,
552-862-8672.
Damien.
412-282-6056.
Lastly, any comments?
The only thing I would say is, like you mentioned, it's our busy season, but Nick and I are both licensed to help anyone in PA, West Virginia, or even Ohio. So I got clients everywhere. So if you know somebody or anywhere local, be happy to help.
Great way
Okay.
to close it out, Damon. Thank you.
All right. Thank you, everyone. And as always, stay healthy, stay safe, and we'll see you soon.